Many adult patients come to me already on ADHD medication, and I see a lot of the same mistakes, so I wanted to make a video about it. So if you're working with a prescriber to find the right ADHD medication, here's 5 things to watch out for. Number 1, switching the medication or changing the dosage too early. I've talked about it in other videos, but it is very important to ensure that there's been enough time to pass to know what's doing what. When people do, they have the best sense of how it went, what's working well, what could be better. If people are able to hang in there a month at an adult starting dose, they're gonna find the right medication that is optimized much sooner. So it's that ironic ADHD duality that people with ADHD, they just wanna sprint to the finish line. And remember, it's not just the medicine, it's the behavior as well. It's taking the medication and trying to move on with your life so that there's a pattern of behavior that changes secondarily to the medication. The devil is in the details. You wanna know what symptom you're having. Is it difficulty starting tasks? Is it difficulty following through with things? Are you distracted? And where? At the workplace while you're working. In the office, what desk are you at? But you should work within the 1-a-day parameters until you get to the next appointment, because you'll have the greatest sense for what's going on rather than, I don't know if it's working good. I guess so. Well, yeah, that's how it is. So mistake number 2 is switching to immediate release too quickly. Immediate release stimulant medication is the oldest psychiatric medication that's been consistently prescribed on the market today. We're going back to the 1930s. And it used to be in the drugstore shelves in the 40s and the 50s. Can you believe that? We've come a long way. So therefore, old habits die hard, and many people think stimulants are just always prescribed this way, when in fact around the year 2000, extended release capsules were introduced to the market, which now change up everything. It's totally reasonable if you have ADHD to find a medication that you take every day and you just feel normal, take it like a vitamin. But to get there, we might have to change from one extended release to another. It's always better to try to problem solve with the extended release capsules you have available at your disposal or other medications. And the reason why I don't prescribe immediate release is it doesn't work. I always have a rolling caseload. They're like my quarterly follow-ups. It's been years. I've known these people for so long. It's such the vast majority of my patients with ADHD that get into a once every 12-week follow-up pattern that I'm gonna assume we're gonna find it. I'm never gonna think immediate release is gonna be the best option. However, that doesn't stop my patients from debating it with me for a long extended period of time. Mistake number 3, switching type of stimulant medication too quickly. So someone does well with Adderall, but then they switch them to Ritalin. Or someone does pretty good with Ritalin, but then they switch to Adderall. So on either side, there's little horizontal moves you can make. Similar but different. So you want to find the one that you do better with generally and then individualize. If you do good with Adderall but there's side effects, go to Vyvanse. If you do good with Concerta but there's some side effects, you go to Focalin. But you're going to see a benefit on either side, and the side effects are going to be mild. You're not going to be dealing with agitation or anxiety or jitteriness or feeling uncomfortable. You should feel calm, you should feel like yourself. So if you don't feel that way, then you switch to the other one. If this is making sense, go ahead and hit that like button. Here's mistake number 4, prescribing too low of a dose. I talked about this in one of my videos, the Goldilocks guide. The adult starting dosage is 20 milligrams. I've had patients who have had 5 milligrams of IR or XR Adderall prescribed and then doesn't work, and they're like, you gotta find the right medication dosage. You start at 20 if it's Adderall XR and you go up to 40. So somewhere in between there, someone's going to do well, but if it's too low, you'll just be tired. So that tiredness is the telltale sign that the dosage is too low. Mistake number 5, there's someone just making it way too complicated. Trying different things, switching up the doses, taking medications away, giving it back, let's try this, let's try that. When we're trying medications, we're going through a trial. So there's first an initial response, so then you reassess, how did that go? But each step along the way, we're learning about the options and we're learning about the diagnosis. Because if the symptoms don't resolve second or third line, there's going to be a comorbid issue that makes treating ADHD impossible right now, or they don't have ADHD at all. What do you do if your prescriber is making any of these mistakes? First, bring it up. Show them this video. But here's my methodical approach. Pick a medication, either Adderall XR or Ritalin long-acting 20 milligrams. You give it a month and you reassess and you adjust the medication. If it's not working, it could be that it's too low or it could be the wrong medication. But you want to do one thing at a time because you want to know what's doing what. Otherwise, you're just guessing. And that means the patient and the prescriber are wondering what the heck is going on here. Most prescribers want to listen and they want to help. I remember when I was a kid, 17, 18 years old, my first medication appointments, the doctor was like, hey, did you focus good? And I was like, I guess. That's why I'm putting my process out there, because it's predictable and it works. And now you know what to look out for. If you want to stay informed about ADHD and the treatment recommendations through my practice, sign up for my email list. Link is in the description. I'll set you a PDF about how to develop a workout routine with an ADHD brain. But if you want to know why I think Vyvanse is an overhyped medication, go ahead and check out my video right here. And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner who won't sell you short.